the Astral Radio Network, and the Dr. Don Show. It's your health, it's your life. Now, back to the show. Here's Dr. Don.
All right, listeners. Now, there's many of you out there that have got chronic pain. There's some of you that go to a registered massage therapist regularly or when the condition you have requires it. And there's probably some of you that are wondering, you have some questions about massage practice that may involve some treatments, some conditions, even some billing questions. But for those of you who have not yet seen a massage therapist and you're wondering about how this can help you recover or stay healthy, because remember, healthcare is not always just about when you're in pain. Healthcare is always about, can be wellness, as we call it, and what do you do when you're healthy to help stay healthy. So in the Vancouver area, our number is 604-280-0650. Long distance, toll free. We love to pay the call. We're a generous operation here at AM 650. 1-877-280-0650. So local call 604-280-0650. Long distance 1-877-280-0650. And of course, if you're shy, that you're in pain, just type in your keyboard, email radio@bcchiro.com. We want to hear about some of the things that you've experienced. And if you've had a rather outstanding story about recovery that you want to share with Anne and our listeners, why don't you give us a call and tell us about that as well. And how many massage therapists in British Columbia today? Do you have an idea?
About 2,800.
2,800?
Yes.
So the BC population is becoming progressively better served in community clinics, private clinics, and I know in shared clinics, multidisciplinary settings all over the place.
Absolutely.
What do you see coming next for the Massage Therapy Association of BC in terms of programs, initiatives? What are you seeing at the school? I mean, you're going to Vietnam. What are some of your other colleagues sort of doing outreach things going on, or are you unique in this area?
I'm definitely not unique in this area. What I found is when I started talking to my colleagues about this program, many of them came to me and said, well, actually, I'm already going to Tibet, and I'm doing some work there. So I want to encourage all of my colleagues as well as the students to seek out different volunteer opportunities. I didn't start doing this until 10 years down the road, and I just told my students, don't wait as long as me.
Well, Doctors Without Borders, covers a lot of things. It's not just the medical doctors that are going to practice in other countries. I know one of my colleagues, he heads down to Guatemala now every year for the last 5 years. We've got some other folks I know over in Madagascar, and recently Dr. Scott Haldeman, he's created another world process trying to provide help to people around the world with spine and spine-related conditions. A lot of the skills that are evolving out of, well, we'll say Europe or North America, they seem to be skills that are well used in other countries, regardless of how good those other healthcare models happen to be. So let's say a typical patient comes in. What would a person look for if we have one of our listeners in chronic pain? If you were to sort of think back to your last new patient that came to your clinic, what would be the typical thing that a new patient is booking an appointment to see you with that our listeners need to know? Because a lot of people don't know that what's wrong with them. They don't know where to go. And like we said at the beginning of the show, this is about empowerment. This is about knowing what you need and who can provide it. So help our listeners. Tell them what your last new patient was complaining about.
Probably my last new patient was complaining of a stiff neck. They woke up in the morning, wasn't able to turn their neck, having pain, didn't know exactly a mechanism of injury, just suddenly that's what they woke up with. So what they can expect is to go and get an assessed treatment to find out if it is a muscular related injury or just something that a tight muscle, that they slept funny. That's a common complaint that we generally see. But a lot of massage therapists treat patients who have been in car accidents or workplace injuries, and that's something that they can get through insurance. So ICBC will cover massage therapy for accidents, and also Workers' Compensation Board will also cover massage therapy. So,
well, car crashes, we know, regardless of what people sometimes think, car crashes don't recover in 2 weeks.
Absolutely not.
Unless the side of the doors sort of glazed each other and maybe scratched the paint a little bit. But the traditional thing where the car gets hit from front, from back, or there's a side impact, a T-bone crash, the effects, the mechanical trauma that the person undergoes it's a very complex number of symptoms and tissues and symptoms rather that get involved. And we see these people certainly not just in your profession, these people are going to multiple professions trying to find help all the time to manage chronic pain. So give us a bit of a characteristic of what happens in a car crash, for an example. What would be some of the common complaint, and what are you doing for that patient? Is it something they see you with once a week or twice a week? What seems to be an optimum schedule?
Optimally, I would say at least twice a week, sometimes 3 times a week, depending on the severity. Primarily soft tissue injury, and um, really work to decrease the hypertonicity and the spasms.
Their work, I imagine, has something to do with this too. I mean, people don't want to stay off of work. Contrary to popular belief, people aren't looking for excuses to stay home. They get bored after 2 or 3 days. They struggle. They try to go to work. So most people who have had some kind of injury, they're actually sort of walking or getting to work, and they're having some discomfort. And if our jobs are repetitive, I suspect that kind of contributes to the return of the symptom.
Yeah, unfortunately, a lot of the people's workplace actually just reinforces the postures that are in pain. So it's really hard for them to receive that rest unless they're actually able to stay off work.
Most of us have a repetitive nature of our job description. Even if we're standing and moving around, there is a repetition to that standing and repetition to that moving around. And with the computer and technology these days, we hear a common complaint just from the body being frozen before a computer.
Mm-hmm.
Did you see a big change in your practice the last 10 years as the technology and the computers became such a dominant force of work delivery?
Absolutely, but I think that the biggest thing is when we talk about the youth, we're looking at the kids coming into my practice or teenagers, and they're complaining of tight shoulders and neck, and they're having carpal tunnel like symptoms, and they're just not getting out as much and playing outside. They're just on the computer, and they have to know how to use the computer. They have to know how to do their projects on the laptop. But it's really important that we educate them how to position their body
Right.
correctly.
So you think we're seeing a shift in education, and not only in what is being taught, but how the subject material is being taught. We're seeing that there's a lot of technology involved at an early age.
Of course, yeah.
And we're not seeing the sort of traditional outdoor physical exercise activity programs we used to see.
Yeah.
And then when they get home, what are they doing? They're on the
Computer.
computer, or they're on the Xbox or something else, the gamers. Yeah, so we're going to have to take a look from, as the health industry or the health sector, we're going to have to take a look at how education is delivered and how students are getting, make sure they get a balance. So Anne, let's talk a little bit about the children aspect of this. When you graduated, when did you start to acquire skills to look at children and infants?
We do some basic infant massage in the massage therapy diploma program. I think that the techniques that you would use for kids on children or infants, it's not that different from an adult, but you do have to modify some of your techniques, pressure, and possibly take into consideration the joint development. But I started to look at pediatric massage when, as a registered massage therapist, just like chiropractors and physios, we are governed under the Health Professions Act, and we are required to take postgraduate courses. So I was kind of looking at, what kind of courses do I want to take? Pediatric massage looks interesting. I love kids. I'm interested in kind of working with kids, so I decided to take that course, and from there it just kind of took off.
Now, this is an area that I think we want to try to give listeners sort of a general understanding. So if you're a caregiver or a relative of a young child, or you have a young child yourself, what would you tell the parent or the caregiver to be aware of that would suggest that that child might benefit or should be seen by a registered massage therapist?
Well, I think that some of the same issues that any adult would have, things like constipation, some abdominal massage can really help with, especially with children. If they're having problems sleeping, obviously massage can help decreasing the level of hormone that's really associated with elevated levels of stress. So that can help with the children, but that's the same with an adult as well. But if you're noticing that your child isn't sleeping well, or they're having some tummy issues, colicky, then it would be a good idea to seek someone who is trained in infant massage or pediatric massage.
Now, I suspect that before a parent is going to bring, or I mean, parents, we don't always think about, the different health resources. We know what's available for us as adults, but we don't necessarily transfer that knowledge to what a child or an infant might need, because there isn't a great deal of information for parents to even be aware of that in the first place. So for the parents that are, having a child with some of the symptoms you just described, chances are they've probably already been to a medical practitioner. They've probably been through a number of the normal things that an adult would think about. So it's probably sounding like there's a chronic issue here. In other words, the tension you described, some of the body functions you described, they're ongoing despite everything else the parent's done. And that's when you would get called.
Yes.
And what would you typically see in terms of a response? We know that when we're dealing with spine and spine-related problems as chiropractic doctors, we know that within 3 or 4 office visits, the patient is starting to change or improve. What's your experience? Because we're really talking about practice-based evidence.
Yes. Well, obviously, I think that if a child is nonverbal, it's going to have to come from the parent. You're going to have to ask the parent to come in maybe twice a week, 3 times a week. And usually what I say is, if within that time, after about 5 or 6 treatments, if you notice a change, then that's great. We can work with that. If you haven't noticed a change with 5 or 6 treatments, maybe we can refer you to someone else. And I know that chiropractic can also be very helpful for colicky children, as well as maybe some acid reflux, that spinal manipulation can help with that.
So we're having to educate the parent to observe what's going on in the child, because if the child's 1.5, 2, 3, 4, or 5, like you said, their communication skills aren't there, and all we're doing is watching their behavior and interaction with other kids or yourself. All right, we're speaking with Ann Hong, registered massage therapist. Now we're coming up to the half break. So what does that mean, Michelle?
It means we got to get up and do our stretches.
All right, listeners, so you know what this is. You got to stand up, get off the sofa, get off the chair, and you got to stand up in this little stretching exercise. Function is life, life is function. So you're going to stand up, you're going to bend all the way to the left, to the right, forwards, backwards, and turning. You're going to do that 5 to 10 times. Right now, it's all about your health. You're listening to the Dr. Don Show, live on AM 650.